It's time for a health report, and joining us now is Africa54 health correspondent Lino Mudu with an update on the coronavirus. Hello, Lino.
Hello, Esther. And the coronavirus outbreak is upending air travel and causing people to question the safety of cruises. Travelers are canceling trips to Asia, and some are even refraining from eating Chinese food prepared in countries that don't have a widespread outbreak of the virus called COVID-19. VOA's Pearson tells us about the most important safety measure when traveling.
Doctors have warned for a long time that an infectious disease anywhere is potentially a disease everywhere. Case in point is the global spread of HIV/AIDS. Another case, SARS, severe acute respiratory syndrome. It was discovered in China in February 2003, and like the current coronavirus epidemic, the government had to build special hospitals. Before SARS was finished 6 months later, it had spread to more than 24 countries, mostly through air travel. Toronto was especially hard hit, with more than 400 cases and 44 deaths.
Air transportation network is the main pathway for a global disease spread.
Think of all the things you and tens of thousands of others touch at an airport and in an airplane. A study from the Massachusetts Institute of Technology shows that very few people in an airport have clean hands. And if we want to slow an epidemic, we have to have clean hands.
First of all, we try to calculate if the rate of hand washing around the world.
Previous studies showed that 70% of people wash their hands after using a toilet. And out of that number, only 6 or 7% do it correctly.
So correctly, I mean they wash their hands with soap and water for at least 15 seconds. We did some back of the envelope calculations, and we found out that if you visit an airport any time in the world, you will realize that only 1 over 5 people have clean hands.
Nicolaides then looked at what he calls super spreader airports.
A super spreader airport is an airport that combines 2 characteristics. The first one is that has a lot of traffic, has a lot of people around. And the other characteristic is that it's connected with many other airports, with many other international flights.
These airports are basically the 10 largest in the world. John F. Kennedy in New York, Los Angeles International, London Heathrow, Hong Kong International, Beijing Capital are among them. Airports and airplanes are close, confined areas with large mobile populations who have dirty hands. Nicolaides calculated that if 60% of travelers had clean hands, the potential to slow a global disease rose to 69%. But even if just 30% of travelers had clean hands, the spread of disease could drop by 24%. Nicolaides says educating the public is the key. Carol Pearson, VOA News, Washington.
Immunizations are vitally important, and the World Health Organization says vaccinations currently prevent 2 to 3 million deaths each year. Vaccines protect against more than 25 debilitating or life-threatening diseases, including measles, polio, meningitis, influenza, and cervical cancer, according to the WHO. In 2018, an estimated 19 million infants worldwide were not reached with routine immunization services. 60% of these children live in 10 countries, including Angola, Brazil, the Democratic Republic of Congo, Nigeria, and Vietnam. Medical experts say 1 in 5 African children lack access to the basic vaccines that could prevent child mortality. For more insight on the importance of immunizations, we are joined in the studio by Dr. Chizoba Wonodi, Nigeria Country Director for the International Vaccine Access Center of the Johns Hopkins Bloomberg School of Public Health. Dr. Wonodi, thank you so much for joining us.
Thank you for having me.
First of all, give us a sense of the landscape of immunizations on the African continent.
So in Africa, about 1 in 5 children don't receive the vaccines that they require. Having said that, I should also point out that that means that 4 in 5 actually get the vaccines they need.
Yes.
So what this means is that we are definitely making progress, but the progress on immunization has stalled. So there's something we call stagnation in the coverage of immunization, where for the past 10 years or so, coverage has only been at about 80%, 85%.
So why are we seeing this stagnation?
We're seeing this stagnation for a variety of reasons. First of all, it's easier to increase coverage when you're at the lower level. So it's easier to go from 0 to 20% than to go from 60% to 80%.
Okay.
So by the time you get to 80%, you can say most of the low-hanging fruits have been plucked, right? The children who are easier to vaccinate have been vaccinated. So, but what we then need to do is to focus on the fifth child, that is called. That's the last 20%, which is harder to reach. And some of the reasons why it's at that level is, number one, lack of knowledge. So in Nigeria, for example, where we have 7 million children born every year that need to be vaccinated, about half of them don't get vaccinated. And one of the main reasons is that the parents are not aware of immunization. So there's a lot that we need to do to educate the parents to avail themselves of immunization.
So how do we reach that fifth child? You talk about educating the parents. What else? How do we do that first, and what else can we do?
That fifth child is mostly in a number of places. Number one is in rural areas, remote rural areas. That's where you're likely to find that fifth child. Another place you're likely to find the fifth child is in the urban slums. And then a third place is, where you have conflict. So conflict prevents health workers from getting to those children. For example, in northeast Nigeria, where you have Boko Haram and all that. So if we have targeted interventions that will reach remote rural, urban slums and conflict-affected areas, we have a better chance of reaching the fifth child.
And so how is your organization really changing this landscape for more positive results?
So my organization, the International Vaccine Access Center at the Johns Hopkins School of Public Health, works with government to provide technical assistance. And one of the things we're trying to do is to look at how we can use SMS reminders to improve uptake of immunization. So we have a study in northern Nigeria where we will send SMS reminders to parents to let them know that take your child tomorrow or in 2 days' time to get vaccinated. But there are a number of different approaches to do that. The first one is in terms of education, lack of education, we need to put out information out there through the media, through traditional leaders, through social media, through women's groups. Another thing that needs to happen is to support and strengthen the cold chain system so that vaccines are available at the points where they need them. In Nigeria, for example, the last 5 or 10 years, Gavi and other partners have really supported the government to expand the cold chain capacity. Okay. So whereas before where you had, maybe just a few fridges and freezers, but now you have cold chain capacity going to different wards and different communities. And
speaking of Gavi, this year is the Gavi replenishment, and it's a time where leaders gather to talk about investment in vaccine and immunization. Why is this year important, and what is to be expected?
This is a very, very important year for Gavi, and indeed for all the countries that Gavi supports, because if Gavi doesn't have the funding, then it doesn't flow down to the countries. We're expecting that at least the donors will give as much as they gave last replenishment, which was 7.4 billion. Okay. So if they give more, that would be fantastic, because Gavi has done a great job. In the last 20 years they've been in existence, 760 million children vaccinated, 22 million lives saved, several new vaccine introductions supported across the country. In Nigeria, for example, Gavi has supported 5 different new vaccines to be introduced. Okay. And those are vaccines against pneumonia, against hepatitis, which causes cancer, vaccines against meningitis.
So many other diseases.
So Gavi has really supported countries to introduce new vaccines that will save more lives.
Okay, we have to leave it there. Dr. Wonodi, we'll be keeping an eye on it. Thank you so much for joining us.
My pleasure.
Dr. Chizoba Wonodi is the Nigeria Country Director for IVAC, Johns Hopkins Bloomberg School of Public Health. And that's our health report for today. To stay in touch, find me on Twitter @LenorModu. Esther, back to you.